If your tooth falls out, pick it up by the top part, avoiding the root to prevent any damage. Rinse it gently with water, and if you can, try placing the tooth back in its socket, carefully aligning it. If that's too painful, place the tooth in milk or hold it between your cheek and gums to keep it moist. Get to a dentist quickly. Teeth reattach best within an hour. The metal file could snap off inside your tooth during a root canal. And this usually happens because your roots are curved and narrow, meaning the file can get stuck. If it's in too deep, the dentist could actually break through your tooth while trying to remove it. Instead, they'll leave the broken piece inside, sealing it off with the filling. And since it's made from medical-grade steel, it won't cause you any harm. The germs enter a tooth through a cavity and infect the soft inner part. This infection causes your body to react, making the area swell and pus to form inside the tooth. As pus gathers, pressure builds up, leading to swollen gums. Then the pressure forces the pus to create a pocket, forming an abscess at the tooth's root. If the abscess isn't treated, the infection can spread to your jaw and other places. You grind your teeth. Over time, you can actually shred them down significantly. This is because as the teeth grind together, they break down the tooth's hard outer layer. This exposes the softer layers and nerves underneath, causing your teeth to experience painful sensitivity. And since the tooth no longer has its protective layer, it increases the risk of cavities, tooth decay, and severe jaw pain. If your wisdom teeth are impacted, they start to grow in your jaw at an angle. This misalignment causes them to become trapped under your gums. As they continue to grow at an angle, they can push against the other teeth, forcing them to become crowded and possibly even crooked. If not removed, the impacted teeth can cause the gums to become painfully swollen, and this often leads to infection. When you floss, the thread of the flosser removes food particles in between your teeth. But if you don't floss, these food particles will accumulate and build up over time. The bacteria in your mouth will feed on this buildup, creating acids that mix with saliva to form a sticky film on your teeth. Now, over time, this film will eventually harden into tartar, which can build up on the gum line. This can cause the gums to become infected, which can eventually lead to tooth loss. When you get your teeth whitened, a dentist will cover your gums in a protective barrier to shield them from the chemicals. Then, a concentrated bleaching gel is added to each individual tooth. Once the gel is on, a special light is directed at the teeth that activates the bleach by slightly heating it. This enhances the whitening process and allows the gel to penetrate the outer layer of the tooth, lifting away the stains. When you get punched in the mouth, the fist pushes your tooth against your jawbone and gums. This can make the tiny fibers that hold your tooth in place start to stretch. If they're stretched too far, these fibers can snap, which makes the tooth loose. At the same time, the force also pulls the entire root from the jawbone, and the tooth can be completely knocked out of your gums. A dentist cuts a flap in your gums right above your front teeth. Then, a very small drill carefully files down the bone on top. Once the bone has been shaved back, the teeth are now more visible. The gums are reshaped and stitched into place on your nice new smile.
Let us know. Thank you.